Hi, I'm Dr. Rajani, and today I'm talking about how do you stay looking young, looking more youthful at the age of 50? What are the treatments you should be thinking about? More importantly, what are the treatments you should not be thinking about? So many misconceptions, and without going into it, I'm going to assume that we know diet, we know exercise, avoid smoking, and for this purpose, we're going to assume that people already have a skincare routine. By 50, hopefully people start a skincare routine in their 20s, and of course that includes sunscreen. Sun kills our collagen. Let's dive in to what are the treatments to avoid. Now, number 1, 2, and 3, I'm gonna hear all the time, hey, I just turned 50 and I was thinking about getting a chemical peel, microdermabrasion, that one kind of kills me, and a little bit of Botox. Those things aren't going to make you look younger at 50. The reason is, those are things that likely should have been done at 20, 30, and 40. And to preface, 50 isn't always the same. So not everyone at 50 is going to need all of these things, but as a rule, by 50, there's enough collagen loss, there's enough elastin loss, there's enough sag and facial hypertrophy, so growth of fat in the lower face, if you want to think of it that way, and sag, that those kinds of treatments aren't going to provide the lift where someone's going to go look at you today and then 3 months after those treatments say, hey, you look younger. Remember, Botox stops muscle movement. What we need are treatments that give more lifting, volumizing the upper face, and lowering the volume in the lower face, because that's what makes people look a little unusual when they only get fillers, is that volume and bulk in the lower face, because you're adding to where the volume sits as we age, the lower face, as you can see in this diagram here. You go from having an inverted triangle to the pyramid of age, and that's what we're trying to avoid. The top 3 treatments that people by 50 as an average age should be thinking about getting, we'll start with number 3, and that would be RF microneedling. I'm going to include VFR in there because there are no needles that enter the skin, but it's kind of a newer technology where the electrical energy gets deeper. Now, I've done complete videos on RF microneedling and VFR because the radio frequency heat, we can affect the external part of the skin or the internal part of the skin, and that's important because we're trying to build collagen, build elastin, but also reduce fat here, but keep our fat up here. By keeping the fat up here, then we don't need as much fillers, biostimulators, and other treatments, and it helps keep that inverted triangle of youth going. But the fact of RF microneedling, the fact that we can adjust it, is extremely important because everyone worries about loss of facial fat. We want to lose it in some areas, maintain it in others. And around the under eye, as an example, you want to get rid of the baggy area of fat, but you want to keep the fat where the trough is, or that volume loss where we often add fillers, or the tear trough filler. So it's extremely important to know who's doing your procedure and the settings. Not as important as the device, although that does play a role, but who's doing your treatment. Number 2 is a thread lift, or PDO threads, in combination with something like your VFR or your microneedling. So these aren't exclusive. By 50, think about combining all of these treatments because there's enough fat, bone loss, and hormonal changes in the skin that combinations are a necessity. Lifting threads can be combined with smooth threads, but that barb or molded lift helps reoppose the tissues. The benefit of that is you need less filler. You need less biostimulator because picture a heavy nasolabial fold here. If we can reoppose the tissues and lift it, now we need less filler in the front of the face. Remember that lower face that makes us look funky? We need less volume added. So consider threads, and there's some controversy. A lot of people are, providers particularly, are threatened by threads because people don't need facelifts as early, or they avoid and delay surgery. Not everyone likes that that's a possibility now. Number one is fillers and biostimulators. This is an important one because fillers, think of hyaluronic acid fillers, calcium-based fillers like Radiesse, and then think of biostimulators like Sculptra. I would say PMMA or Bellafill will be considered a biostimulator, although that's permanent. And then PRF or platelet-rich fibrin, which is all natural. And so you have your choice, all natural towards synthetic and permanent, towards something like Sculptra, which goes and leaves the body mainly by about a year or less. So it's semi-permanent, some would say. Now for me, I prefer biostimulators, although fillers play a role in certain areas like the under eye, the mid-face, the lip. We often don't use biostimulators there, but to get a full natural result, it's combining those. And here's where the problem comes in. Many people are going to ask, I can't find a physician or a provider that does those things. The aesthetic industry is booming, so I understand we haven't caught up on the training side to fulfill what the demands of the public are. And this is coming. We're making great strides, and even we have some information coming for you this fall that's going to help you find providers, but that is a problem. Find a provider that you identify with that does the majority of the procedures, and you'll find these are evolving and the training is catching up, and there are more FDA approvals, such as for the mid-face, the jawline, the chin, of all the areas that you want. A lot of what we do is still off-label. At 50, if you don't want to have surgery, then those are the treatments I would consider. Surgery is always in the mix of conversation, depending on patient's goals. It doesn't come into the conversation in the 40s, but by 50, certainly it's a consideration. Those who want to avoid it, maintain. The more you maintain and do your skincare routine, your healthy diet, your healthy exercise, the less you have to move to those 3 treatments. I put a complete playlist up here, things you can do at home to prevent having to have procedures done. Keep your skin and body beautiful, healthy, and vibrant.